This material is for information only. It does not replace a doctor visit. And in this video I explain why Rybelsus is an oral semaglutide medicine for adults with type 2 diabetes, and why the real value is understanding where it fits better than other options before any treatment decision is made. Rybelsus is the branded oral form of semaglutide, and semaglutide belongs to the glucagon-like peptide 1 receptor agonist group that helps control blood sugar in a glucose-dependent way. The European product information describes semaglutide as a glucagon-like peptide 1 analogue made in yeast cells by recombinant DNA technology, which matters because this is a complex modern medicine rather than a simple old tablet copied from a basic chemical formula. That is the starting point for any fair comparison with supposed generic versions or look-alike products. The verified approved use in the materials I reviewed is adults with type 2 diabetes, either alone when metformin is not appropriate or together with other diabetes medicines, plus diet and exercise. Weight reduction is seen in trials, but the labels I reviewed frame Rybelsus as a diabetes treatment, not as a sports enhancer, and not as a medicine formally approved here for general fitness goals. So when viewers hear claims about weight loss first and diabetes second, that is already a reason to slow down and check the source. In simple words, semaglutide helps the body release more insulin when blood sugar is high, reduces glucagon, slightly slows the first phase of stomach emptying after meals, and also lowers appetite. That is why some people see both better sugar control and some weight reduction, while the same stomach effect also explains why nausea and fullness are so common early in treatment. The medicine works, but it asks for patience and careful dose escalation. For comparison, the closest same molecule reference is not a generic tablet proven in regulator material, but the same active substance semaglutide sold in another form such as Ozempic injection, while older study comparators in the Rybelsus program included empagliflozin, sitagliptin, and liraglutide. In the official documents, the documented bioequivalence evidence concerns different Rybelsus formulations rather than a separately named approved generic oral semaglutide. That means any simple claim that a standard pharmacy generic of oral semaglutide is already established should be checked very carefully against regulator records. The international non-proprietary name is semaglutide, the oral trade name in the regulator documents is Rybelsus, and the United States label now describes 2 tablet formulations with different strengths that are not interchangeable on a milligram-to-milligram basis. In that label, those strengths are 3, 7, and 14 milligrams for one formulation, and 1.5, 4, and 9 milligrams for the newer formulation, while the European document lists 1.5, 4, 9, 25, and 50 milligram tablets. A practically important inactive component is salcaprosate sodium, an absorption enhancer linked in the label to pregnancy and breastfeeding cautions, but the full inactive ingredient lists were not completely retrievable in the sources I fetched, so I cannot verify every excipient here. How you take the tablet is almost as important as the tablet itself. The label documents say it should be taken once daily on an empty stomach with a small amount of water, swallowed whole, and followed by at least 30 minutes before food, drink, or other oral medicines, because earlier intake can reduce absorption and the product already has variable uptake from the gut. If a dose is missed, the labels say skip it and take the next dose the following day rather than doubling up. The most common adverse effects in the official documents are nausea, abdominal pain, diarrhea, decreased appetite, vomiting, and constipation, and these problems are most frequent during dose escalation. The same sources also warn about pancreatitis, gallbladder disease, dehydration-related kidney injury, hypersensitivity reactions, diabetic retinopathy concerns, rare pulmonary aspiration around anesthesia, and in the European text an added signal for a specific optic nerve problem called non-arteritic anterior ischemic optic neuropathy. Rybelsus is contraindicated in people with a personal or family history of medullary, thyroid carcinoma, or multiple endocrine neoplasia type 2. And pregnancy planning needs discussion, because the label advises stopping semaglutide at least 2 months before a planned pregnancy. The strongest recent evidence update is not a generic comparison, but a formulation and outcomes story. A modern study reported that a second-generation oral semaglutide formulation was bioequivalent to the first-generation formulation with no new safety concerns, and a large cardiovascular outcomes trial called SOUL found that oral semaglutide lowered major cardiovascular events versus placebo in high-risk type 2 diabetes, without an increase in serious adverse events. That gives the branded oral product a stronger evidence base than many casual online discussions suggest, but it still does not create proof of superiority over every alternative for every patient. This is why I would discuss the choice carefully with a doctor if a patient already uses insulin or a sulfonylurea, has eye disease from diabetes, has severe stomach emptying problems, takes levothyroxine or warfarin-like medicines, or expects surgery under deep sedation. The label documents interaction concerns through delayed stomach emptying, including increased levothyroxine exposure, and the European text also recommends closer monitoring for coumarin-type anticoagulants. In real decision-making, the choice is often between oral semaglutide, injectable semaglutide, or another diabetes class, not between a well-documented branded tablet and a clearly verified approved generic tablet. On cost, there is an important evidence gap. I do not have enough regulator or peer-reviewed price data in the material reviewed to give a dependable international average or a clean region-by-region price range. So any economic comparison should be verified locally through pharmacies and insurance rules rather than guessed from marketing pages. The practical takeaway is simple: ask which formulation is being prescribed, which dose step you are on, what side effects to watch for, whether your other oral medicines need timing changes, and whether an oral or injectable semaglutide plan fits your goals better. Save this video, share it with someone managing type 2 diabetes, and subscribe to the channel so you have a careful reference before your next appointment. Please remember that this video is informational only. It is not a medical recommendation, and no one should start, stop, or switch Rybelsus or any semaglutide product without speaking to a qualified clinician first. The clearest thought to leave with is this: a well-chosen medicine is not the cheapest one or the newest one, but the one whose benefit, risk, dosing routine, and evidence actually match the person in front of the doctor. Subscribe to the channel for more evidence-based medicine reviews.